especially in this crisis-driven economy. In typical proactive fashion, ANCOR devised a shared resources purchasing network to stretch every member's operating budget for everything from office supplies to latex gloves and diapers. These dramatic cost-saving benefits even extend to staff and individuals receiving services. Banking on the collective power of volume buying, ANCOR's innovative purchasing program is helping members reduce overhead so they can redirect the savings to changing the world where it matters most.
Reimbursement for providers nationwide has either been static, with no increases over multiple years, and in the current economic crisis, being cut.
And with funding being cut or level funded, every penny we can save to put into services is a step in the right direction.
So we have to be able to make the most out of the dollars that we have. And that prompted us to take a look at a national purchasing arrangement where we could maximize discounts because we were purchasing on a national level rather than just on a state or local level.
We put together a consortium of partners that brought cost efficiencies and savings to the table for our membership. And this could range anywhere from office materials to medical supplies, and actually to some retail shops, to mention just a few.
We have partnered with a couple of ANCOR's top vendors, and we have gotten some great discounts and some great deals on just things that help us do our business better every day.
We do a great deal of conference calling. We were paying 64 cents a minute. Now we're paying 4. The savings are incredible.
I think what is unique about our purchasing program is the connectivity to leading practice on purchasing and cost controls.
And that has allowed for us to save money, but also to really learn about some new products that potentially, had we not been involved with ANCOR, we would not have had the opportunity to be engaged with providers that really have a particular niche of understanding our industry.
The opportunities don't just stay in the front office. The opportunities go to the staff as well.
And as an individual, I have taken advantage of that and recently purchased a computer for my son as he enters college. So there are advantages to members and to individuals in that purchasing program.
The way to activate the participation is go to the website and sign on to the various partners that you have an interest in. Once that starts, then the savings can begin.
Helping our members stay current and connected is just one of ANCOR's most pressing priorities. From webinars and seminars to conferences and retreats, ANCOR ensures easy access to the latest information on service delivery transformation and leading practices in the disabilities field. Many members place high value on the guidance they receive in complying with the complex regulations required by Medicaid, HIPAA, and employment law. Others applaud the abundance of formal and informal networks that abound for ANCOR members to work together in support of each other and the industry as a whole.
I look at ANCOR as being a connector of resources.
ANCOR takes people with real-world experience, puts them in a room, and comes away with a plan that's workable.
It is also an organization that needs membership involvement, and participating in committees is very important to shaping what agendas we want to carry forth for this year and for the following years.
Wherever our services and benefits resonate the most, shared knowledge is leading to shared growth and shared success. And that's what keeps ANCOR members grounded in community.
The future. I'm very worried about it. And if there was ever a time when my organization and like organizations needed ANCOR, it's now.
Even with ANCOR's impressive resources and uncanny ability to foresee change, the future of serving Americans with disabilities will be fraught with untold challenges. Demographics alone will stress capacity to the max, and recruitment difficulties will plague our industry until real parity is achieved once and for all. Until that day comes, when our system's capacity finally exceeds the demands of the human condition, community-based providers will need each other more than ever.
We're at an unprecedented time in the history of service delivery to people with disabilities. And that's brought about by multiple factors, not the least of which are the demographic shifts that are taking place in the country. As a consequence, we're going to see a major transformation in how supports and services are delivered and how they're funded.
I think that the visioning of ANCOR is an ever-moving target, and I think that's the great thing about ANCOR, is that it moves with the future.
ANCOR has done an enormous amount of work for us to really help us understand our field, where it is going, and how we can really take part in some of those changes that are taking place.
ANCOR also provides us the opportunity to be proactive and to begin to communicate with individuals, with entities, about what services can look like in the future and how we as providers can be a part of that future.
With so many worthy causes clamoring for the same public dollars, there is no safe place to sit on the sidelines, just as there is no time left for reactive thinking.
There are very few services that ANCOR is able to offer that we haven't found a way to take advantage of. And these services have produced measurable results for both our staff and for the people we serve.
ANCOR has an array of services from purchasing power to legislative power to policy power that they can help support your organization.
It's just a matter of taking advantage of the information, taking advantage of the resources, taking advantage of the meetings, taking advantage of the webinars.
Just take a look. Take a look at our Performance Excellence Initiative. Take a look at our Shared Resources Purchasing Network. Take a look at what we're offering in professional development. And take a look at our public policy priorities for advancing our agenda with the new administration and with Congress.
Commit yourself to ANCOR. Be a proactive participant in the community of community providers. And together, we will be on the forefront of shaping a future that will secure our rightful place on the healthcare horizon for generations to come.